Hi, this is Dr. Nikita from Max Hair Clinic. Today we'll be talking everything and anything about hair.
What is the most common hair concern that people approach you with?
Majorly, it is androgenetic alopecia. So, if you look at the statistics, around 90 to 95% of hair fall is male pattern balding. It identifies as a M-shaped pattern. It's the most common type of hair fall.
Is this issue typically associated with the Norwood scale?
Yes, male pattern balding is classified based on Norwood scale. So, we have two. So, for the men, it's Norwood's, and for the women, it's Ludwig scale.
Could you please elaborate on that a little bit more?
So Norwood scale is a classification where we generalize male pattern balding. So we have stages from 1 to 7. So majorly people in stage 1, it will not be identified much. You'll not be able to notice much of changes. The person alone will be feeling a lot of hair fall and a lot of thinning. When he starts to experience a little bit of hairline receding, that's when he's in stage 2. When he's in stage 3, you can have a prominent M-shaped pattern. Stage 4 and 5 is majorly your crown getting affected. Stage 6 is almost 70% of the balding, and stage 7 is when you've lost it completely on the crown, on the top portion.
For individuals who have experienced complete hair loss, what treatment options are available?
Depends on their donor, on their general health as well. So we restore what they've lost. So majorly focus on restoration programs. In Max Hair Clinic, we can do it both clinically and non-clinically. So clinically is your hair transplant, and non-clinical is your cosmetic hair restoration.
Can stress genuinely lead to hair loss?
Yes, stress is one of the major reasons for people losing hair these days. Those days it used to be falling sick or maybe using the wrong product or a parasite sitting on your hair. But now, as everybody's jobs have evolved, their lifestyle has evolved, stress is the major reason people lose hair, be it men or women.
When consulting with patients, would you say that the session feels more like a counseling experience than a traditional consultation?
What I feel in my 7 to 8 years in this field is people don't exactly come and ask, I've lost my hair, I'm feeling bad about it, because it's still a taboo to talk about hair loss. So people mostly say I'm happy with how I look, but my family is forcing me to get treatment. So that is majorly how they come for it. And people especially planning to get married, they're the ones who are giving up all kind of oils and tablets and they come for treatment. So more than a consultation, I feel like first I have to understand what exactly the patient wants. So it's more of like a patient-doctor conversation, I would say counseling.
Is there a particular patient story that, stands out, like someone who truly opened up about their experience?
So there's this one story which happened about 1.5 years ago. There was our client, he was 71 at that time. So he had a late, his wife had a late pregnancy. So when he was 71, his kid just started going kindergarten. So in their school, they used to have this practice where, they draw whatever they feel. So this kid drew his parents. So he drew his father with hair. So this particular person, he was not much into hair, or he was not, concerned about the way he looked. But when his kid drew him with hair, that's what shook him. So when he came to us, he was like, I don't know what you're going to do. I'm ready to spend how much ever, but please give me hair. So I wanted to be realistic, because for his age and he was completely bald. So we had a good discussion, and we ended up giving him a hair transplant with all the donor that he had. We gave him a good density in the front. So it was a 2-step surgery where we focused in the front first and then we went on to the back. So when we gave him hair, about 7 or 8 months after this surgery, he actually came for this review which we have, and he said that I look exactly how my kid drew me. So that is one story which it's deep in the heart.